So once I got really comfortable with inlays, crowns, fixed bridges, implant restorations done with CAD/CAM, we started to look at other ways in which we would use the technology in the daily operation of our practice. We see a lot of patients in hygiene. We see a fair number of new patients as well. And when you think what we do for new patients, which is probably what most practitioners do today, we chart the patient's clinical findings. We take a piece of paper and we actually draw every tooth, every restoration, a chip, the filling material, and we go around the arch and gather all this information. So we have a digital computer record, the way most dentists do. So we would then scan it, throw it away, and now we have it in the system. And then I realized, why wouldn't you scan that patient as opposed to trying to draw a record of the patient's pre-existing condition? So now we take every new patient at the first visit, they get scanned. We don't charge a separate fee for it, but it does a couple of things. One, it introduces the patient to this technology, which impresses virtually every patient. Two, if the patient has a restorative need, it gives me the ability to show them using the scan, the way you would use an intraoral camera. Three, it enables me to make comparisons. So if that patient had tooth migration 2 or 3 years from now, if the patient was concerned about recession, I would be able to compare the scans and make an objective analysis of what changes actually took place. And then there's another possibility. What if your patient had a bicycle accident 5 years from now and fractured a front tooth? You realize by our having that pre-existing scan, we have the original form of their teeth. We even have the shade, as the device we use today captures the shade of the patient's teeth. So if they called the office at 8 o'clock on a Monday morning saying I had an accident, I broke my front tooth, by 8:30 we would have a temporary that would be the right color for them to come into the office. So the potential to use these devices today is just as broad as your own imagination. So my patients really understand the technology. We describe it to them, we describe it on our website, and the more knowledge they have, the more effective they are at being ambassadors for their friends and family and telling others about our technology.